You'll recall the other day, maybe it was yesterday, maybe it was, I think, last week, Wednesday, I reported that the death panels, yes, the death panels. And by death panels, of course, what we mean is that Medicare will actually pick up the tab for end-of-the-life consultations with doctors, which will save lives, which will save money, which will help people whose loved ones are incapacitated. I think there is complete and universal agreement by everyone in the medical profession, everyone in the social work profession, everyone in the health insurance profession. I think probably every profession, short of the professional liars on the right, that end-of-life counseling is incredibly helpful for everyone involved. And the idea that Medicare would pay for it is a great thing because it needs to be encouraged and it needs to be raised by doctors to remind people that, hey, if you don't have a living will, you need one. That's what it is. It's basically a living will. And so it was reinstated into healthcare reform via regulation, which of course it can be. The idea that Medicare will choose different procedures that it will pay, it's not a legislative decision anyways. But, of course, Fox News responds in typical fashion within just days of somebody noticing that it is now a regulation that can be picked up by Medicare on January 1.
Are the so-called death panels revived? If you thought the death panel debate was dead, think again. It's heating up, and you have to stick around to find out what's in store for end-of-life planning starting this Saturday.
The elderly and senior citizens watching this show right now better know that doctors are going to get reimbursed for pushing you into hospice and pushing you into no treatment for serious conditions. That is going to be a fact as we move down the road. I hope people understand that.
You know what, Grandma? It's going to cost the government too much money to keep you alive. So here are your alternatives.
And it's with Obamacare that people are going to die based on who the government thinks ought to die.
In other words, the government will now pay doctors to counsel patients to opt out of medical treatment that might prolong their lives.
And the more government takes over health care, the more government rationing there'll be. And the more the government will tell you whether you have to have a living will or whether you have to discuss it with your doctor every year or every 5 years.
Donald Berwick, you remember him. He's an open proponent of the British style of universal health care with rationing of medical services decreed by bureaucrats. He's the socialist who wants to decide who lives and who dies. He announced that he had created the death panels pursuant to authority in the new law.
These end-of-life counseling sessions appear to be less voluntary than the administration would say, and the government appears to be trying to script what is actually said in these counseling sessions rather than letting your doctor decide.
Unbelievable. Unbelievable. I don't think in that minute 43 compilation there was a single not lie. And it would be incredibly amusing to hear about death panels and how doctors are incentivized to give you less treatment. Of course, they'd get paid more if they gave you more treatment. It's quite possible that an end-of-the-life counseling would require more treatment. It would be hilarious to listen to that compilation of Fox idiots, were it not for the fact that Robert Pear in the New York Times reports today that the Obama administration will revise a Medicare regulation to delete references to end-of-life planning as part of the annual physical examinations covered under the new healthcare law. They have reversed themselves. Was anybody even discussing this outside of the tiny universe of morons and idiots in Fox News? You know, what we're going to need is some type of color coding system. When the Obama administration actually capitulates, we could put we could color code it with like a sky blue, like a filing system. And when the Obama administration appears to capitulate, but actually is really carrying out their agenda, their neoliberal agenda, like cutting Social Security, we could put like a red or maybe like a heather yellow or something like that label on it. This would be the sky blue. This is just sad capitulation. We will amend the regulation to take out the voluntary advanced care planning. The official said this should not affect beneficiaries' ability to have these voluntary conversations with the doctors. Of course it won't, except for they'll still be able to have the conversations, but they just won't be able to get reimbursed for it. It'll cost them money. So it's basically just a disincentive to have something that every single person who works within the healthcare field on every aspect of it thinks is a good thing. And I would remind you that these ideas of these consultations, not panels, just one doctor, they can't even get that part, is not a lie, was promoted by Senator Johnny Isakson from Georgia, Republican, and then 3 Republican co-sponsors in the House with Earl Blumenauer, the Democrat from Oregon. So congratulations. The terrorists on the right have been rewarded again.